Good afternoon, ma'am. I will be assessing the patient's head and neck. But before we start, let me show you what are the equipments that we will be needing for today's video. So without further ado, let's get started. Good afternoon, ma'am. I am Katrina Mae, Dela Fuente, your student nurse from Medical Colleges of Northern Philippines. For verification, ma'am, may I know your name po?
Dela Fuente.
Okay, how about your birthday?
June 9, 2005.
How old are you, ma'am?
16.
So for today, ma'am, I will explain the procedure that I'll be doing to you. I will be assessing your head and neck, and for me to able to assess that, I will be able to touch certain parts of your body, specifically your head and neck. So it is okay with you, ma'am? Okay, ma'am, rest assured that all of the documents and findings are completely confidential with me and the physician that I will be referring you to. Do you have any questions po, ma'am?
None po.
Okay, what language is comfortable with you? Is it Tagalog or English po?
Tagalog.
Okay, ma'am, I will perform the assessment na po, but before that, I'll be doing the hand hygiene po. Isasarado ko lang po yung cortina to provide privacy. Assuming that I already closed the curtains, let's get started with the assessment. Before I start, ma'am, I will just have a quick history about you. Are there any lumps and lesions on the head or neck
None.
that do not heal or disappear po?
None din.
None. Okay, that's good to hear po. How about difficulty po in moving your head and neck?
None.
None po, okay. How about facial and neck pain po?
None din.
Alright, so I'm going to start na po. Then I'm going to start to look at your head and face po. I'm looking at the shape and size of your head po, which is appropriate for your size, and we call that normocephalic, or it is normal size of the head for a human. And then I'm going to palpate your whole scalp po.
Pause mo na.
And then I'm going to palpate your whole scalp here and checking if there are any lesion, masses, or lumps po, ma'am. Alright, I didn't see any signs of lesions, mass, or lumps po, ma'am. Alright, and then I'm moving on by inspecting your face and look for symmetry of the face. While looking for symmetry, I'm also looking at the eyebrows, eyelashes, and eyelids. The side of the mouth should be symmetrical. If there is one side of the face that dropping, it would indicate a problem with cranial nerve number 7. Okay, ma'am? Can you blink your eyes po? Okay, ma'am. Can you close your eyes tightly po? Okay po, ma'am. Can you raise your eyebrows po? Okay po. Next po, can you smile po? Like that po. Okay po, ma'am. Frown po, ma'am. How about you puff your cheeks po? Okay, very good, ma'am. Wala naman po akong nakitang abnormalities while you do that. Both sides are pantay naman po. So, ma'am, I will palpate your temporomandibular joint by placing my fingers over the front of ear po. Allow me to touch your face po, ma'am. While palpating po, I'm going to ask you to open and close your mouth po. Any pain po while you open or close your mouth po? None. Okay. I didn't see any swelling and hindi naman po ako nakaramdam ng clicking. And that's good to know po. Do you feel any headaches po these past few days?
None din.
Okay, that's good to hear po. Okay, next po. Okay po, ma'am. Can you simply a small amount po? And can you hold po muna yung water sa mouth mo? Can you swallow it na po? Okay po, I can see po that your trachea is in the middle line. Nung lumunok naman po kayo is okay yung naging process and tumaas po yung dito part and that's normal po. I didn't see any bulging or swelling pagdating sa neck part nung uminom po kayo. Nakaramdam po ba kayo ng tenderness or pain po? Okay, that's good to hear po, ma'am. Di naman po kayo nahihirapan sa paglunok po?
Hindi rin.
Okay po, so next part of our assessment, ma'am, I'll be checking your cervical vertebrae. So next part of our assessment, ma'am, I'll be checking your cervical vertebrae. Posteriorly ko po siya i-assess. Okay po, ma'am. Sa kabilang, can you look at this side po? Okay po. This side naman po. Down po, ma'am. I don't see any abnormalities naman po nung ginawa nyo yung procedure, ma'am. Next naman po is i-check. Next naman po is i-check ko po yung neck range or yung neck motion nyo po. So, can you please look at the ceiling po, ma'am? Okay, how about look down po? Okay, can you look at the right po? And how about sa left po, ma'am? Okay po. Do you feel any tenderness or any pain po nung ginawa nyo yung procedure?
Wala po.
Okay, that's good to hear po. So, next one, ma'am. I'll be palpating your trachea po. Can you look up again po para mapalpate ko po yung at malaman ko pong nasa middle place siya. Okay, ma'am. Palpate ko lang po siya. Can you swallow po? Okay po. I can see that your tracheal rings are working and maganda naman po yung paglunok nyo. Can you please look up again po and face po tayo dito to flex your neck. Okay po. Dito po, ma'am. Okay, ma'am. Nasa middle line po yung trachea nyo. Next one po, I'll be osculating your thyroid gland to see if there are present roots po. Can you inhale po and then hold your breath for a while, tapos exhale po. Inhale again po. Okay po. I can see that there is no present roots and your carotid artery are well functioning po. For the last one po, I'll be palpating your lymph nodes. So, allow me to touch your face po again. So, right now, I'm palpating your preocular nodes. Okay po, which is in front of the ears. I'll be palpating your post-auricular nodes just behind the ears, okay? The occipital node po, okay? The tonsillar node and submandibular nodes. Okay po, ma'am, relax lang po kayo. Yung face, relax lang po yung face. Submental nodes, okay po, the superficial node, the deep cervical node, posterior cervical nodes, and the supraclavicular nodes are okay po. So that is the last part of our assessment po for the head and neck. If you have any questions or clarifications, or if you felt anything in your health po, I refer you to your attending physicians, and siya na po ang bahala mag-explain ng mga bagay na need nyo pong malaman. I didn't see any abnormal findings naman po. Thank you po for your cooperation. May tanong po ba kayo?
Wala.
Okay, that would be all, ma'am. Thank you po.